So talking about the agenda of today's session, it's basically about qualitative research. It's about how it's different from quantitative research, what are its main approaches, and what are its principal methods of data collection. So over to you, Dr. Sara. Thank you so much for agreeing to be the expert for this session.
Thank you, Gohar. I'm sharing screen, please. And I'm putting myself on
Yeah, the screen is on, ma'am. We can see your PowerPoint.
can you see it shifting
Yes,
screens?
yes, ma'am.
Excellent. So thank you, CLT. Thank you, Gohar, Dr. Ruxana, and thank you to all the participants who've joined us today. This is basically a hybrid session where you've all received a video tutorial from Dr. Sikandar Hayat, and I'm really honored to be conducting the second half. We've sent you a video tutorial and you've sent us feedback about comments and suggestions for what to incorporate in this 1-hour presentation. So I'm going to try my best to satisfy everything. However, one or two points that registered participants mentioned was that number one, somebody said that we want to go through a whole qualitative research article, how to write one together. So my request to CLT, and if Gohar can write this down, because if I'm not wrong, somebody had requested this last year as well. We can't do that in 1 hour. I mean, it would take a whole other session to go through how to write a qualitative research article just for publication. So what I'm going to do is that each time I discuss something theoretically, I'm going to show you a sample of a published qualitative research paper. And the other real benefit is that post this session, you'll not only get this PowerPoint presentation, but you'll also get a reading package, a reading material, in which all the literature that we're referring to in the published papers, mine and others that we're referring to, are already, the PDFs are already going to be there. There's also going to be a book there on qualitative research, and ebook. Some of you might already have it. But all of that will be available. That's actually FCC calling me. I'll just mute this. And this is what we'll be covering today. We will be covering, and a little bit of this has just been added on specifically after reading your feedback and your suggestions. So the first thing that we'll cover together is actually a reviewer's comment on a manuscript qualitative research paper that was submitted for publication. Now, this was a question from a registered participant, that we're unable to publish qualitative papers because when we submit them, they get rejected. So give us a sample of how to tackle reviewer comments. So I'm going to actually go backwards and start with a published paper, and tell you how reviewers and editors may ask us questions and how we would answer them. And again, this would be a whole other session. It would take 1 or 2 hours, and we could have, this is a request to CLT, maybe that they can plan a session about how to write a qualitative research paper, and then the journey of actually submitting it and replying to reviewers, which can go back and forth. Like sometimes you can have up to 6-7 revisions before the paper actually gets published. But I'm just going to cover that briefly. Then we'll cover definitions and some complexity and specification of what qualitative research is, and the problem of the definition being fluid. We'll cover research approaches, reliability and trustworthiness of qualitative data, sampling techniques. And then we'll also cover a checklist for proposal and publications and the different data analysis techniques under qualitative research. So Bismillah, here we go. This is a published paper it was a paper that we wrote, myself and my colleagues wrote during the COVID pandemic. It was qualitative interviews with operating department practitioners, asking them about the challenges that they faced during the coronavirus pandemic in the surgical setting. So this was the abstract. Obviously, in a qualitative research paper, when you submit it, some things are similar. in a quantitative research abstract versus the qualitative, but some things are dissimilar. So what I've done in this abstract is that, and this presentation will come to you so you can read it in detail. The published paper is also attached in your course reading material. But basically, I've given a background about the problems related to COVID-19 and the surgical setting and how that affected patient safety standards, and how operating department practitioners are the best practitioners and bystanders and witnesses to what's happening in a surgical unit, including they are the best to comment on the challenges and the problems. And then I've written about the methodology, how it's qualitative research, how the data was collected through an open-ended questionnaire with 39 ODPs, and content analysis was used to generate these 10 themes. And then I've listed the themes. And the final sentence in the abstract is the concluding recommendations for how to move forward. And here is a comment from a reviewer. So the classic reviewer one will usually be generous and say, excellent, recommended for publication with minor comments, but it's usually reviewer two that gives you a lot of problems. And reviewer two here has written, however, the study only presents individuals' opinions and feelings, and there is categorization of the answers or scaling. Now, some of you who are already familiar with qualitative research will immediately get shocked. How can a scholar write something like this in a review comment? Because qualitative research by definition is the presentation or an exploration of an individual's opinions and feelings. And again, by definition, qualitative research is the process of coding, creating themes or categorizing data that is coming from the participants, and then communicating it to your audience and reader to shed more light on the research area. So here I go with the author response. So we can also see that the background of this reviewer is that possibly they are quantitative researchers. And these kind of demarcations exist, that quantitative researchers can't understand what qualitative research is all about, and why qualitative researchers aren't sharing statistics and numbers, and why they're sharing feelings of participants. And you will always have such reviewers, and we have to learn how to deal with them. So the author response is here, this is what I've written back to them. I've said, thank you so much. This is a qualitative study, and the aim is clearly outlined. So remember that in your qualitative research paper, there are certain subsections that have to be included, and that's the aim. So I've copy pasted exactly the aim that I've written in my manuscript when I submitted it to them. And here in your revision, if then you've not written it, you can actually revise your manuscript and include it. And I've clearly written that my aim is to understand the individual opinions and feelings of the ODPs. And my aim in qualitative research is to summarize their findings through categorization or thematic analysis. And then what I've done in the second half of this answer is that I've just found all the articles that I could related to qualitative research under the surgical research area or medical research. And I've pasted those APA citations with the links. And that is how you satisfy reviewers. Disengaging with them or saying, I don't find your question to be justifiable, doesn't make sense. It's better to answer them in this manner. So hopefully this answers the question. I get bad from a registered participant that I get rejections for qualitative research articles, and then we have to move to quantitative research. We all get those rejections, but there's a way to answer, and you keep trying. Sometimes it takes years to publish qualitative research. This is true. My colleague and I'd like to share, Dr. Hamna and I have one quantitative research paper that has been under review for 4 years. They're neither rejecting the paper, neither are they accepting it, neither are they pushing it online. And with a qualitative research paper with another colleague, Dr. Mudassar, it's been 6 years and it hasn't been published. And we are just now looking for another journal. So this happens with all of us. So what are the basic definitions? Now we're going back to the roots and moving forward. The definition of qualitative research, it's that it is a research strategy that usually emphasizes words rather than quantification, i.e. rather than statistics, bar charts, pie charts. And as a research strategy, it's broadly inductivist, constructionist, and interpretivist. And we will be exploring this as we go on with the slides. The complexity with qualitative research and research scholars under this domain is defining the nature of qualitative research, and then associating research methods with it. And this is because under qualitative research, you can have ethnography, participant observation, you can have qualitative interviewing, you can have focus group discussions, you can have language-based approaches where you're just doing discourse analysis and conversation analysis, for example, of TV dramas. You can have, and you can also do the collection and qualitative analysis of texts and documents like political diaries, diaries of politicians or historians of the past. In this way, basically, another way to explain this is that you can have very neat definitions of qualitative research. But at the end of the day, qualitative research, like other sciences, is fluid. It's ever evolving. And so the definitions and the research processes and the means of research is ever evolving as well. One example of this is that during the pandemic, online interviews and online recording and online transcribing, old qualitative researchers had to change their methods and their research approaches if they wanted to continue with research activities. So deciding on qualitative research, now this was again a question from the registered participants. Well, how do you decide? And the simple answer to that is it depends on your research question. So let's say your research question is, how many physicians are currently working in the private versus public sector of Pakistan? You want to know numbers. So you will have to go the quantitative direction. Versus your question is, what are the experiences of physicians working in Pakistani hospitals? Here, then you'll have to take the qualitative direction because you're looking at trying to understand their experiences, their life situations, the challenges and their voices. So you have to go the direction of qualitative research. You can use quantitative survey scales, perception-based items, but and usually in that case, you also you opt for mixed methods research where you have open-ended questions if you want to collect rich and comprehensive data and discover as many themes as possible. Because remember, when you're designing a quantitative questionnaire to understand participants' experiences, you will still suffer the problem that you will be deciding the scales and the items, and the responses will be coded. So you will miss out on any data that comes from the participants based on IDIs, in-depth interviews, or focus group discussions. I hope my voice is still audible. So the electricity is coming and going, but I think we're not getting disconnected and the voice is continuing. So all should be good. If there are any problems, is it okay, Gaurav? And you can hear me clearly as well. Excellent. And we can take another example. Let's say our research question is, what are the social demographic characteristics of doctors in Pakistan? How many are male versus female? How many are from Punjab versus other provinces? How many are from rural versus urban areas? Then again, we'll have to take the quantitative direction. Also because we want large numbers. We want to be able to represent all of Pakistan. So we won't be able to do qualitative research. And then versus we have a question, well, do physicians or doctors with certain socio-demographic characteristics, i.e. urban versus rural, experience workplace bullying and exclusion? And here again, we would then opt for qualitative research because we want to go in, have in-depth interviews with rural versus urban doctors, say 20 each, to understand whether there is a difference in the experiences that they face when they are in a work setting, in a hospital, in a surgical unit. So what's inductive reasoning? Now, this is students and a lot of junior faculties is usually very eager to understand the difference over here between inductive and deductive reasoning. So the deductive reasoning is usually associated with quantitative research, and inductive research is associated with qualitative research. By definition, inductive reasoning aims to find theory from the data. So though a literature review is done, and though you're reading many theories when you're reading literature, your aim in qualitative research is to go in, find data, generate themes, and then that should help, that process or journey should help you to generate themes. Grounded theory is theory that is derived from the data and is systematically and scientifically gathered and analyzed through the research process and different qualitative research analysis tools, which we will be discussing. Now, this flowchart by Foster helps us understand the semi-cyclical nature of qualitative research. So you may start with generate an idea, a conceptualization, then you move into literature review and you decide you're a little bit more certain about your research question. You then decide based on that research question, where you will be collecting data, who you will be collecting data from, and then you start collecting that data. Point 3. While you're collecting that data, and I'll give you a realistic scenario. Let's say you've got a semi-structured questionnaire, you've gone and collected data for 2 hours each with 2 participants. In the night, you'll start reading that data. And then let's say we spend another 2 weeks collecting data from 20 participants, and we're reading the data continuously in the evening, in the night, in the morning before we go for data collection again. And we start deriving themes, initial derivation of themes and categories. But we realize that our data is not enough, or that certain data that is emerging, we want more information related to it. So let's say our initial, and I'll give an example. Let's say our initial research question was, what kind of workplace bullying do women, female doctors face compared to male doctors? And we find during the qualitative research data collection process that women are not just talking about workplace bullying, but they're also talking about family level barriers, that we may face some obstacles in the home, at the workplace, but the obstacles that we face in the homes and with in-laws and with brothers is even more challenging for us. And those challenges we keep having to bring at the workplace, which affects our productivity and our service provision. And so we want to go back into the field and see, this this little circle over here from 4 to 5 to 6. We have a more tighter specification of the research questionnaire. So whereas our semi-structured questionnaire initially included 5 questions, we have now decided based on the initial 20 interviews to include a 6th question. And we say we're going to go in and collect data from another 20 participants, including this 6th question, because the previous 20 participants are talking about barriers from the home. And we want more data from this question. And then once we've collected all that data and simultaneously we're analyzing and reading our data and developing the first set of codes and theory and themes, we finally decide that we've reached saturation point, or there's no more data to be found, or realistically we don't have any more time, we're on a budget, we have to submit our MPhil or our PhD thesis, and we decide to stop data collection. And at that point we move to 6, which is writing up our findings and conclusion. So a little bit about now hypothesis and qualitative research. It's usually considered, I have 40 minutes left. It's usually considered that qualitative research and hypothesis has nothing to do with anything with each other. And this is not true. So researchers develop the hypothesis, qualitative researchers develop hypothesis by listening to what the research participants say after data collection. So this is where sometimes you'll hear researchers say, well, I went for qualitative research first, generated a hypothesis, and then I went for quantitative research. And the whole project was mixed methods in this way, but qualitative research came first. And then there's also the issue of non-testable hypothesis, where even in manuscript, where people will do only qualitative research, but based on a literature review, they have some kind of a working hypothesis. And they're not trying to test that hypothesis when they go into the field to collect qualitative data, but it allows the researchers to focus and specify their research questions and objectives and be more prepared when they go into the data setting. So this is again a common question that people ask, well, should we include quantitative research when we are doing literature review for qualitative research? And the answer is yes. And if quantitative research is predicting certain hypotheses, stating hypotheses, like women who suffer from child abuse in adult age will suffer from urinary tract infections. Now, this for qualitative research can actually be a working hypothesis and can help you generate a more tighter open-ended research question or a semi-structured research question, a questionnaire. But the aim, obviously, in qualitative research is not to go in and use your hypothesis for testing and for significance. but rather to help you have better objectives when you're going in for data collection. More definitions. What's phenomenological? What's the phenomenological approach? What's action research? And what's flexibility in qualitative research? So the phenomenological approach aims to study a phenomena as it is experienced by the participants. So let's say we're going into Hunza Valley and we are asking people living in that region what their experiences are. And our aim is just to reveal the phenomena rather than what causes it or why it's being experienced, which is usually something that quantitative research tackles. What's action research? Action research is defined as the researcher and the members of a social setting or the participants that you're aiming to collect data from. They are coming in partnership to diagnose a problem and to develop solutions. So with action research, what usually happens is that, let's say, the microfinance loan officer, the researcher, and women microfinance borrowers all come together to try to develop solutions of how to make the loan portfolio a better package so that women borrowers are not only returning loans, but actually the quality of life is also improving while they remain loan takers. What's flexibility in qualitative research? This is the ability to use multiple qualitative research tools to get the best output and the richest data. So you're not just using in-depth interviews, but also focus group discussions and also participant observation. And another way, it's not just about data collection tools, but it can also be about different means of analyzing data and having a wider team to come together to analyze your findings so that there's more robustness and there's less bias. And I'll be giving an example of this in the coming slides. Another definition, which is usually commonly associated with qualitative research, this is reflexivity. It entails a sensitivity to the researcher's cultural, political, and social context, and also the researcher's sensitivity in understanding where the participants are coming from. So what are the participants feeling and thinking when they are answering questions? Another way of looking at it is, where is the participant sitting and who might they be afraid of when they're answering questions? This can also help you to zoom in and pick better places of data collection or better means of data collection. So let's say you decide to ask, you're aiming to ask questions related to domestic violence or relations between spouses and within the joint family. But the place to ask that question is not in the house of the woman or in focus group discussions where other family members or neighboring women are present, because that might compromise what they share or how much they share or how realistically or whether they will share honestly at all. Again, reflexivity also entails acknowledging the researcher's baggage, assumptions, political leniency, culture, etc. So let's say a researcher has political preferences. They prefer one party over another, and they're collecting data about political opinions. This is where they have to be very careful, again, not to have biases in, and then they can ensure to have a research team which is a little bit more balanced. Let's say one is supporting party A, another one is supporting party B, and then a third member should be there who doesn't support any political party to balance things out. So reflexivity really is about re-evaluating findings, making sure that you have reflexive insight when you are analyzing your data, so that when you're communicating it to your readers, your audience, your stakeholders, or the participants, or the people from the setting where you collected data from, there is less bias and there is a reflection and understanding of the time and social space and the environment. And so this is a very heavy burden on qualitative researchers, but it's better to know about it and be prepared, as opposed to not going in prepared and saying, I'm going to do qualitative research, but I'm not going to know it, not going to consider reflexivity of the researcher or the participants. So another very common issue is that people feel that reliability, validity, all of this is only associated with quantitative research. And again, this is not true. Qualitative research is very scientific, and there are robust ways of ensuring reliability in qualitative research. The two main areas is authenticity and trustworthiness, which we're going to be covering together. So authenticity in qualitative research is assured through fairness, fair representation of different viewpoints among members of the social setting. So again, let's just take an example of the healthcare model. And I want to understand what happens in a surgical unit and what the problems are which compromise patient safety. Fair representation would be that I don't just interview the surgeons, but I also make an effort to interview the nurses, the operating department practitioners, the surgical ward assistants, because they are all responsible and they might share information about each other that affects your final results and conclusions. Ontological authenticity, this assists researchers and members to arrive at a better understanding of their social environment, because it's very important to understand, again, this is similar to what we were discussing, the background and the environment and the setting. Educative authenticity, this helps researchers and members to better appreciate the perspectives of other members of their social setting. So understanding that possibly the challenges that a surgeon from an upper class family, from a background of family background of surgeons, generational surgeons, somebody who comes, who's educated from abroad, they may face different challenges compared to a surgeon who's come from a rural community, from a low middle class background, who studied only from Pakistan. They may face different workplace and administrative challenges. Catalytical authenticity, this acts as an impetus for members to engage in action to change circumstances. And this is usually what every researcher is concerned about, that even if their initial research aims is not about change and improvement, but you will notice that in their concluding recommendations, there will be a recommendation that if this is the problem that we found from our qualitative analysis and from the experiences and the challenges of our participants, then possibly this is what needs to be done. So some qualitative research will all be about recommendations and improvements, because the initial research question was about that. But ultimately, all qualitative research, whether the component is large or small, will end with recommendations for improvement, because that's what social sciences is about, generating research and empirical evidence to make the world a better place. Tactical authenticity, finally, this empowers members to take steps for engaging in action, maybe going back, talking to stakeholders, talking to the government, and developing policy for improvement. So trustworthiness, the other aspect that helps us to secure reliability in qualitative research. And this is made up of 4 criteria. Credibility, this is when we take our findings and share it back with our participants or people from the same setting who didn't participate in our research, and ask them whether our findings are of value, whether something is missing, whether something may be erroneous. Transferability, this is the use of thick description, ensuring that you've collected enough data, reach saturation point, there's rich data. If we share it with other independent researchers, they will be satisfied as well. So this is why a lot of journals, qualitative research journals, now ask you to share your data, anonymized data, because they want the other researchers also to be able to benefit from your data. And if it's not sufficient enough, and if it's not rich enough, then there's a problem. And this is what transferability is about, being able to transfer your data to others and having their validation as well, that this was rich enough data to conclude what you wanted to conclude about that setting or those participants or that case. Dependability, this is the auditing approach with records of all phases of the research, i.e. we usually get stuck with students who will share research with us, and we will ask them, well, where are your audio recordings? Where are your transcript data? How did you reach these codes and these themes? Give us the backdrop. And they say, we don't have it, we lost it. So this is something that you have to secure from day one. Once your research proposal, qualitative research proposal is approved, it's gotten a certificate clearance from your IRBs, this is where you have to start keeping an audit on yourself. Don't do anything without taking consent and recording and saving that data. You can see my office as well. It's just filled with old data, anonymized data. Somebody takes it, nobody's names will be revealed, but the data is there. Confirmability, personal values or theoretical inclinations of the researcher must not be part of the data collection, data analysis, or the presentation of results. Now, one of the examples that I'll give for myself is that I'm a Shia. So when I was collecting data for the Hazara Shia community, though I'm not from Hazara, I felt that I'm too biased over here. And so what I did from day one is that I requested colleagues who were not from the community, not from the Shia background, to come and join me in the research project. And they collected the data. I was not part of the data collection process. And we all independently analyzed the data and then shared our views and prepared the manuscripts. And this is very important, that your biases, even if you feel the bias may be genuine, is still in the scientific research process is taken care of. So that if anybody outside ever questions you, you have a team where there are people maybe from the community versus also people who are not from the community. So there's no chance of any bias or any emotions coming into your research presentation. The onion approach, no qualitative workshop or seminar can be complete without sharing this. This is also true for quantitative research. This is a very nice summary of all our tools and techniques for under qualitative and quantitative research. At the outer and the upper peel of the onion, you can see positivism, which is associated with quantitative research. And then on the right side, outer peel near the bottom, you'll see interpretivism. This is associated with qualitative research. And then as you move inside the inner peel, you'll see that with qualitative research, you can use multi-methods of data collection. I've just mentioned them. We'll keep covering them as we go forward. In-depth interviews, focus group discussions, participant observation. You can then opt for case study approach, ethnographic research, action research, and then you will move towards which qualitative data collection tools you'll use. So I've summarized this over here, and this is thanks to Abdul Karim and colleagues. If you've chosen ethnography, for example, your focus is to understand context and culture of a certain community, then your data collection will usually be observation, participant observation, and interviews. And the data analysis technique that you'll use is thematic analysis. So I'm reading off the first row over here on the upper table. So this is a bit like a formula. You keep this with you, and a lot of people get confused. They're like, okay, we've decided we want to do ethnographic qualitative research, but now what do we do? Well, then you move towards do your literature review, develop your open-ended semi-structured questionnaire, start collecting your data through observation and interviews, and then use thematic analysis. Similarly, in this table, we can just take an example of one other case. If you choose case study qualitative research, your focus will be to understand everything under the domain of what this organization is doing. So like I did case study research in my bachelor's, what I did is that I did a case study of the Bangladesh Investment Bank, Bangladesh Islamic banks. And here I used interviews with bank officers, documents, reports, and observations. And again, I used thematic analysis to analyze the data and to report the results. So we should have done this earlier, but many of you already know this. If you don't, it's textbook definitions. But it's important to go through as well. This presentation would be incomplete without it. What are interviews or IDIs, in-depth interviews under qualitative research? This is just asking questions, listening, recording answers from an individual or group. You could be using a structured, a semi-structured, or an unstructured questionnaire. And sometimes an in-depth interview can last an hour to 2 hours, but it may not be enough. You will be exhausted during that session. The participant will be as well. So you may repeat those interviews later based on the consent and willingness of the participant. Focus group discussions, what are they? They are a group of 4 to 6 members, not advised to have more than 6, because then it's difficult to have give everybody equal time to talk and participate or analyze the data. But it's an interactive session with a group with 4 to 6 members. And sometimes what happens is that qualitative researchers choose to use both ideas and FGDs simply because there will be times when participants will share more in a group because they are encouraged and they remember things based on group sessions. And sometimes they will share more things or other things individually in a one-on-one session which they wouldn't in an FGD. Observation, what's that? Well, there are two kinds, overt and covert. Social scientists always choose the overt approach, which is taking consent from participants and sharing the research objectives and aims, and then observing them. So let's say you take consent from a surgical team and you watch them during the day, how they have their meetings, how they visit the wards, how they conduct their surgical processes, etc. Obviously, there is such a thing as covert observation as well. This is when you don't take permission. We usually stay away from this. This is something that sometimes governments do, or healthcare professionals do with prisoners, etc. It's something that academicians stay away from. Documents, this involves the selection of relevant documents that can answer the research questions for the study. I think we mentioned this earlier, so maybe you have access to secondary data of the government, or maybe you have access to diaries or historical records, written notes of Quaid-e-Azam and his colleagues, and then you start doing a content analysis based on this. So a little bit on different qualitative sampling techniques. So whereas we know that with quantitative sampling, it's random always, there's equal chance of selection. It's exactly the opposite with qualitative research. You can choose either of these 5. Typical case sampling, this is sampling a case because it exemplifies a dimension of interest. So let's say we are interested in understanding what surgeons do during their, I keep using the same example so that we don't get lost. And we're all on the same, and it's not too much information overload. But let's say we want to understand how surgeons deal with have meetings with their patients before the actual operation theater maneuvers, interventions. And so we will be only interviewing surgeons or requesting them for permission during overt observation during the clinical times. Snowball sampling, this is sampling from the network of preceding participants. So let's say we were able to access interviews with 5 surgeons, but now we approach them to give numbers and contacts of their colleagues because we've exhausted our list. And that's snowball or network sampling, also known as network sampling. Extreme or deviant case sampling, this is sampling cases that are unusual or that are unusually at the far ends of a particular dimension of interest. So let's say we want to interview people who have been released from prison over minor offenses. And so what we will do is that we will have to approach the prisons or for whether it's a good idea or whether it's safe for us to contact such people and approach them to understand, maybe let's say the research question is about how well they are integrating back into society after release from prison from a minor offense. Maximum variation sampling. This is sampling to ensure as wide a variation as possible in terms of the dimension of interest. This is the aim to sample until saturation point. And this is usually only possible when you have a lot of people in that community or a lot of participants and access to a lot of participants. So let's say we want to interview women doctors who are not practicing anymore. They did their MBBS, but they're not practicing. So we go into every province, every major city, and we contact medical universities for their records. And then we keep sampling until we reach saturation point. And we know that we would find enough people. I mean, we wouldn't be able to reach a dead end at 5 women. There would be more women in Pakistan. We just need to find them. And then finally, theoretical sampling. This is ongoing data collection for generating theory or until theoretical saturation. So our research aim is actually to go in to develop a theory. This is usually associated with grounded theory generation. And our aim is to generate theory. And sometimes this kind of sampling also continues just like above with maximum variation sampling until we have a theory that we feel confident enough to communicate or share with the rest of the world. Okay, we now move on to a second part of this presentation, which is lots of examples. Now, these are my published papers. All of these published papers are attached to your reading material so that you can read them in detail. And this is an example of how content analysis can be used for theme development and frequency. So I want you to concentrate on the first two columns first. You can see that themes have been generated and then sub-themes, but they're listed over here as category and subcategory. So let's just do one together. Under environment, you can see that there are three. I think the bolds can't be seen very well, but there are two big categories, environment and health delivery system. And under environment, there are three categories: social, physical and mental, and economic. And under social, there are three subcategories. So for example, based on this data, we are trying to find out the health challenges faced by poor women borrowers of microfinance. And we find that unsupport about 56. Okay, and now the third column over here, which is of interest, is that people usually ask, well, frequencies and percentages and numbers are never reported in qualitative research, and this also is not true. Now, even with participants of 20, a study that has 20 participants, researchers sometimes opt to share frequencies and percentages. This is just to give context to the reader. So let's say I have 20 participants and they're women and they're sharing information about not being able to opt for tertiary education, higher education because of family level barriers or societal barriers. A question of interest to the reader and the researcher would obviously be, how many of these women come from what kind of households? Are their parents educated? Are their mothers educated? Do they come from upper class backgrounds? Do they come from lower class backgrounds? Do they come from rural communities? Do they come from urban communities? And so this is where qualitative researchers have started sharing demographic data and then summarizing them in tables. So it's not uncommon anymore to find qualitative research and then have tables in between. And here you can see why, again, it's so important to share and not just report these themes and these sub-themes, but the percentages are telling us that 56.6% of women feel that unsupportive loan officers worsen their health conditions. And that 85.3% of women believe that their health problems are worsened because they do not have access to health centers. And another 87.8% of the sample believes that discrimination from family members for health financing prevents them from accessing health. So this is also just an example of how I reported demographic data. This was a huge sample, and how we managed to get qualitative data from 442 women participants is that we used mixed methods. We had a quantitative survey, and at the end of that survey, we included 3 open-ended questions, which we then analyzed as qualitative data separately. And we published 2 papers from this project. Obviously, we had a big research team and we had a lot of women data collectors. Otherwise, this would not have been possible. And it was a project, the data collection took 1 year. So this is now a realistic example of how themes will be coming in from your transcribed data. So let's say now I have, actually I have a picture of my transcribed data. And I'll go backwards. So please imagine that you've taken an audio device, you've recorded data, and then you've transferred that data into a Word file. So let's say we have 20 participants. Now each participant's file, and those participants will be labeled 1, 2, 3 or 001, 002. You can see over here that the interview code 1, that's just basically the participant's code now. And the name has been anonymized or blinded. And each participant, whether they're 25, whether they're 20, whether they're 30, whether they're only 7, their files should be the same. You can see that here is the demographic data in red font of the participants. In green font is the question, the semi-structured question that we took in during data collection. And in black font is the participant's response. And now I've transcribed that data, and it's a good idea to have two members. So let's say who are checking this transcribed data. So let's say you audio recorded the data, you get a student to transcribe it for you. Then the one principal investigator checks, maybe randomly. I'll check interview 2, 5, and 7, and my colleague will check interviews 3, 6, and 8 to check that nothing has been lost from the audio to the word transcribed file. Once we have this data, I start reading it. Answer: we didn't face much difficulty since all my children are grown up. My son has completed his house job. My elder daughter just got into her house job, and the moment she got in contact, she went into self-quarantine. My younger daughter, who is an FSC, started taking care of the household tasks. She does the cleaning, cooking, and sanitation while I care for my wife. How much burden will be on her when we are both sick one day? So you'll see from this little, and I'm sorry I don't have much time, you'll see from this little paragraph that the participant starts off by saying, we're not facing any different difficulties, but she ends by claiming that the difficulties during the COVID pandemic, or the burden lies on the women in the family. They have had to end up sharing more burdens for home care, for disease care. Their care burden goes up. Now, what I do then is that I open an Excel file and I start making notes about initial theme generation. That is the first column that you see over here. So, and I start coding those themes. And again, we can't spend too much time on this, but you can see in the first column that I've started coding different themes that I'm taking out by reading the transcribed data. And obviously this is a time consuming process. So when a student comes to you or a faculty member comes to you and says, I've read my transcribed data once, you know that that theme generation is not of quality. So let's say I've I've coded this C001, the first theme. Women are saying that they are far away from health centers. And then I've labeled number 11, another theme, unsatisfactory attitude of doctors. And in the end, when I read this data again, I can start tightening my themes. So you can see that all those that in light green are being placed under a darker green theme. This is called color coding of access. And then later at a third stage or a fourth stage or a fifth stage, after I've reread the transcribed data, seen that no other codes can be entered under column 1. And by the way, this can go down to 50 themes initially, the first column. But then those 50 themes should be collapsed into another 10, 15 broader themes. And then those 10, 15 themes can be further collapsed into subcategories. Now, a good idea is to do this manually, but you can also do this, good news is, through softwares like NVivo. With NVivo, the first step is to get your transcribed files ready. Make sure that they are pretty similar to each other. You know, question 1 is always under question in the first order for participant 1 versus participant 27. Shift or transfer all those files in, and then start playing with NVivo. So for example, with NVivo, you can use the summary tab, you can use a hierarchy chart, you can use a tree map, you can use Sunburst. And again, of course, you would have to have a separate session on NVivo training. We can't do that right now. But the useful thing with NVivo is that, let's say if you've done manual coding first, you can actually create nodes and then seek more confirmation and from NVivo. But having said that, you don't have to do manual coding first. You can actually put in the data, and you can then ask a prompt NVivo to generate codes and frequencies for you, from which you can create nodes and codes, right? So qualitative research is getting stronger every day. And one of the basis of that is software tools. It is absolutely also true, somebody asked this, that publishers and editors discriminate against you if they find that you've not used a software. So start using the software. The absolute truth is that even I learned NVivo through the trial version and through YouTube tutorials. And I've been, and many other people do this abroad as well. I have, we blame Pakistan, but I have colleagues and friends who I grew up with and studied with, and they have been doing their PhDs in quantitative research, qualitative research abroad, and they've also been learning softwares through YouTube and other online courses. So just the last thing that I hope I'm not running out of time. There's just the last thing that I want to share with you is
Sure,
that,
ma'am. You can take another 3 to 4 minutes.
okay, I'm just going to go through this publication checklist. Now,
Sure, sure.
I use Correct, but you're welcome to use any other checklist when you start off with qualitative or quantitative research. Now, take a look at this checklist by Correct. This should be your best friend. It's going to take you through and keep prompting you and asking you that under your research team, do you have interviews and facilitators in your team? What are their credentials? What's their occupation? Do they have enough time to contribute? What's their gender? What's their experience in training? Here you can then ask yourself, well, before we actually start data collection, do we need to have meetings for supplementary training? Do we need to register for a course and learn NVivo? And so it's better to be prepared and do these things before you launch into the actual project. So this Correct checklist is useful for writing your proposal, but it's also very important just before you launch into data collection. So the domain one is about research, is going to prompt you and assure that you're on target for research team and reflexivity. Domain two is about study design. It's going to keep asking you about methodological orientation. Do you have a theory? What's your sampling technique? What's your target sample size? Domain three is about analysis and findings, and it's going to ask you important questions about the number of data coders, description of the coding tree, quotations presented. So, you know, a lot of people submit articles of qualitative research, and that themes are there, but there are no quotes. So with qualitative research, the quotes should be there as well. So this checklist is just going to prompt you and ensure that your qualitative research is complete, and that when you communicate it to stakeholders, to editors, to journals, you will not face any problems. And this is the biggest dilemma in Pakistan, that people complete research, qualitative or quantitative, and then they say, well, we missed these important parts, and now we can't publish or communicate our research. So it's what a loss. So use these checklists. These are my references. Actually, I also wanted to cover that there is another way to collect qualitative data, and that's through participant observation. This is a participant observation tool that my colleagues and I developed together. You can see that we included 7 positive emotions and 7 negative emotions to gauge the responses of old age participants while we were delivering an intervention for intergenerational learning. Based on this checklist, based on each tick, we added numbers, and then we assigned a cutoff value in order to determine whether the intergenerational activity, for example, civic engagement or character building lessons, was received positively or negatively. So that's another way of doing qualitative research. And analyzing this is a slide that registered participants asked for. They said, where do we publish our data? So I've just, you can check this later. There are links for locally approved HEC journals, internationally approved journals by JCR, etc. These are my references. Thank you so much. We're open for questions, please. Should I
Thank you
leave?
so much, ma'am. You can stop sharing.
Okay. In case somebody
I
wants to turn back to a slide, I can open it again.
All right, ma'am. We'll quickly go over through the polling. I've launched the polling. You're all requested to please poll, and we have a lot of questions and comments. I'll quickly go over them, and ma'am, you can explain as we have limited time. So I would suggest if you can explain it in less than a minute.
Okay, I'll try my best.
Please do. Thank you, ma'am. Talking about comments, excellent way to decide what it's a qualitative research or otherwise. Miss Rana Rubab Durrani says this. How many questions should be given in questionnaire? Who will decide? Samina Fahim is asking.
A qualitative research questionnaire is a scientific process. You generate it through your literature review, and you include the questions that are relevant. So it could be a questionnaire that has 20 questions with prompts, or it could just have 4 questions as well. So it depends on your research question. It depends on your literature review. It depends on who you're interviewing and how much time you have. So sometimes people develop an initial questionnaire with 50 questions, but they need to abridge it because they realize they'll only have half an hour with the participant. So
Can everyone see the polling? Sorry, ma'am. Can everyone see the polling? I'm not getting any responses.
I saw something, but then it disappeared.
I'll relaunch it. Let's. Can you see it, ma'am?
I can see it, yeah.
Okay. Moving forward, Zia Raja, we can say that qualitative is a base of generating hypothesis.
No, by definition, hypothesis generation, hypothesis by definition is a statement of prediction. In quantitative research, we use hypothesis to test when we go in to collect data. And usually qualitative researchers in the past used to stay away from from the word hypothesis, because by definition, qualitative research does not aim to test hypotheses in the field. But now recently, qualitative researchers say that we include hypotheses that other scholars have found when we are quoting our literature review, and so we use it as a working hypothesis to develop our questionnaire and refine our research objectives and questions, but we don't use it to go to test and to statistically identify anything in the field. Again, the slides are coming to you and the supplementary reading material as well, so take a look at that again. But the
Uh,
aim in qualitative research is never to test hypotheses, but you can use workable hypotheses to refine your research questions.
Thank you, ma'am. So next we have Amna Gul, a PhD scholar from Allama Iqbal Open University. What is the utility of the non-testable hypothesis? Kindly explain again.
Okay, so let's say that we've done a literature review. I gave an example of this, but I'll repeat it. That let's say that our qualitative research question is to try understand the experiences and health challenges of women who experience child abuse. Women now who experience child abuse. So a workable hypothesis is this, that when we studied a literature review, it was a quantitative study. And in that study, the hypothesis was that women who suffer child abuse in adult lives, they have more common experiences of urinary tract infection. So let's say when we're going in with our qualitative research questionnaire, we use that as a prompt. That becomes a prompt. Well, the question is, do you face any health problems and do you think it's related to your child abuse problems? And then the prompt is mental health problems, urinary tract infections, etc. That's how it helps you develop your qualitative research. Does it make sense now? Okay, their mics are not on. Continue.
Yes, ma'am. They can comment.
Okay.
And next we have from Hafiz Rukhsar, Allama Iqbal Open University. Nice presentation, and ma'am, you are an excellent orator. Please revise the points you have to differentiate among the qualitative and quantitative. In which situation do we do one or other form of research?
Okay, so I think the second slide was covering this, but I'll repeat. It depends on your research question. If you're looking for statistics and numbers, let's say your research question is how much unemployment is there in Pakistan. Qualitative research is not going to answer that question. Quantitative research is going to answer how much unemployment there is in Pakistan. If your research question is what kind of problems and challenges do unemployed people face in Pakistan? Do they suffer from suicide ideation? It can be answered through quantitative research as well, but you'll get a lot of unique and rich data from qualitative research, i.e. you go in through purposive sampling and interview people who are unemployed. And you have, let's say, a selection criteria. They have a degree, but they are facing unemployment for the last 10 years. And let's say you also then additionally decide to interview 10 people who are suffering from underemployment and seasonal unemployment. And then they will come and tell you that we're a doctor, but हम vendor के ऊपर काम कर रहे हैं या हम driver बन गए हैं Uber का. And so the data that they will share with you will only come through qualitative research. So it depends on your research question.
We have a question from Samina Fahim. How can we check the availability and reliability of self-administered questionnaire?
Self-administered questionnaire in qualitative research. So in qualitative research, based on a literature review, we design a semi-structured questionnaire, open-ended, and then we take it to our department, our research team, we debate it, we might do we can't do a pilot test, we take it to our IRB, we gain approval. But once we've got approval that it's safe and it doesn't harm anybody and the questions are relevant from our peers, from the institutional review board, then we pilot test it. Based on the pilot test, we might add a couple of questions, add some prompts, realize that this question is not too clear for the participants, rephrase it. And this is now a reliable questionnaire to go in and collect your data. I
Next, we
hope.
have, we'll see that in the comments, ma'am. They'll respond to that. We have a question from Ms. Amna Gul again, and there is a comment to it as well. If we were to interview journalists as to how social media has changed journalism practice, how would the qualitative method be ethnography or phenomenology? And to this, Ms. Nabila Naftali from former Christian College has responded that ethnographic is best to be used when we have to understand cultural context or experience of certain communities. For interviewing journalists, the best method can be phenomenological approach. It can give us better insight into how their practice has changed due to social media.
Yeah, the answer is being given by, you just read out the answer.
Yes, ma'am. That this is what I told you, that we have a comment for this as well. So she gave that. Next, we have Mr. Rizwanullah. Please explain action research with some other example.
Okay, another example of action research is, let's say that I want to work with the old age, with the social welfare department in an old age house, and I want to develop solutions to improve the quality of life of old age residents. So what I do is that I partner with the social welfare department, with youth, with my own research team, and I pull in intervention facilitators and the youth, and I also use the old age participants. And I ask them that I want to deliver an intervention of intergenerational research. Can you tell me which components of learning should we include? And so then I start doing action research. This is action research, where not only are they teaching and developing courses, but the elders are providing us with solutions for which intergenerational activities can be integrated across Pakistan and other old age homes to improve quality of life. So this project may go on for 1 or 2 years or even 3 years until we have a course for intergenerational learning. And that's action research, where the participants and the researchers and maybe even a government body all are working together to develop a solution to do what? Improve quality of life of elderlies living in an old age home. Does it make sense? That's action research.
Okay, ma'am. Moving forward, we have Samina Fahim again. What should be the minimum sample size? Please give reference.
I've published a paper in an impact factor international journal with only 6 participants. Who were they? Religious scholars contributing on social welfare tools and charity mechanisms for that come through religious sects and informal congregational work. So the research question was such that, and the data was enough to meet saturation point even with 6 participants. So the answer again is, it depends on the research question. It depends on the existing participants. And yani, maybe you don't have that many participants. Let's say I want to do qualitative research on the transgender community. And it probably a committee would reply by saying that you could easily interview another 20, 30 people. But with religious scholars of a specific sect, there are only 15. So you've interviewed 6, it's okay. And then number 3, so number 1, it depends on the research question. Number 2, it depends on how many participants are accessible. And then number 3 depends on the richness of responses. If the responses are enough, so if, let's say, the transgender community, there are people in the thousands, but yet I have only data from 10 people, but the data is enough, it's very rich, and I can satisfy, my transcribed files can satisfy the themes that I've generated and also the editors and the people that I'm communicating with, then it's enough. So there's no answer to this, basically. You try your best for as much as possible. You're also time constrained. So you see, if you're an MPhil or a PhD scholar and you've only got a window of 1 or 2 years or even less, then people will accept less. They'll just want that the quality of your research and your findings and your interviews is sufficient for you to be able to say that the themes that I've communicated are as exhaustive as comprehensive as possible.
Okay, ma'am. Moving forward, we have a question from Mr. Saleh from the Department of English at Former Christian College. Can we use deductive reasoning in qualitative methodology, or is it only relevant to inductive reasoning?
So deductive reasoning is usually used in quantitative research because deductive reasoning by definition is you take a theory and hypothesis and then you go and try and test it. And with inductive reasoning, you go into the field to collect data and to generate theory. So we try to stay in those compartments, but at the same time, I told you about the gray areas, which is that sometimes you in qualitative research use workable hypotheses even, and just to refine your research questions and your objectives of study. But by classical definition, deductive reasoning is with quantitative research and inductive with qualitative.
Thank you, ma'am. Just to alert, we have another 2-3 comments and questions as well. But this is just to let all the participants know that we have a session coming up on quantitative research as well. It starts at 1. So you can join that as well. I've sent the Zoom links for that. Next, we have excellent presentation, Miss Maria Malik from Allama Iqbal Open University. Thanks for sharing new practices in qualitative research like use of working hypothesis, inclusion of percentage and demographic tables. We have Aruj Abid. Which research approach would be used if we take insights from stakeholders on some national policy?
So that would be IDIs, in-depth interviews. That's qualitative phenomenological research.
We have another question from Miss Amna Gul. She says, question, for your research, n is equal to 442. The sample size, I guess, since there were 3 open-ended questions at the end of the questionnaire, were these questionnaires self-administered, research
Yes,
administered?
yes, they were, because it was research on poor women microfinance borrowers. So they were either illiterate or semi-literate. So this was assisted data collection or completely filled on their behalf by facilitators.
Miss Aruj Abid got the answer. She saying thanks a lot. And then we have Mr. Rizwan Ullah. He's also saying thanks for the answer. We have another Misbah. Miss Misbah is asking, can we use snowball sampling in quantitative methodology?
You don't use snowball sampling in quantitative research. In quantitative research, you use random sampling and equal chance of selection. Sometimes in quantitative research, you opt for network and snowball sampling when you can't opt for random sampling. Please check with your team and your supervisors related to this. But by definition, we shouldn't do it. We should have a known sample, and then we should have equal chance of selection every third, every 7%. But sometimes it happens that we opt for convenience sampling and then analyze our data quantitatively because the respondents are not accessible to us. It does work. The grays exist. That's a separate session altogether.
Last, we have 2 comments. One is from our expert, uh, Dr. Adil. He's saying, thank you, Dr. Sara. Session was excellent. Thank you for enlightening us. And then we have from Sir Rizwan, that very informative and excellent session on such an important topic on research. Excellent session from Sakkar IBA. Then we have Miss Amna. Love the session. Jazakallah. Thank you, Dr. Sara. We
Thank
from
you,
Miss
everybody.
Nabila. Thank you, everyone, and especially Dr. Sara for conducting this valuable session. Thank you so much, ma'am. See you in.
Thank you.
Thank you. Bye.
Thank you.